criticizing anything is the easiest thing to do. The most positive thing to do is to say, okay, what is it I can do to maybe make a difference?
Patient and family-centered care is really about partnerships. It's partnering with our healthcare teams, with the people that we serve, and with their family members. Being able to have conversations, inviting people to the table, and problem solving together to figure out what we should be doing to serve a person.
Patients and family is the business we're in. It's the work that we do, and in my view, we have to partner with them. They need to be part of our care team. It's the only way that we can actually provide consistent and comprehensive care.
Well, what we needed to do was to invite patients and families to partner with us, to welcome them to the table. There is no one better positioned than patients, clients, residents, and the family members to share their voice than those patients and families who have had the experience themselves.
I'm so glad to be able to see that healthcare professionals are actually listening to the patients and implementing their input into operations and how they do their jobs. I felt like my opinions have mattered immediately after my first meeting with them. I got a few requests for my input, and I was so surprised at how well I was received and how much they valued what I had to say. It was so refreshing. It was heartwarming.
What I've witnessed is seeing a growth of engagement with patients and families throughout the organisation. We have gone from, back in 2012, from having a handful of patient and family partners engaged in our various committees to now over 300 patient and family partners in many different ways, in many different areas.
We have a new build coming up with Providence Healthcare. With that, they will be involved. We've had them involved in some of our different patient health education materials. So if you're coming in for, say, a heart operation, we give you a pamphlet. Well, those used to be written by healthcare professionals, but now they're written in conjunction with patient partners. And they go through a committee which has patient partners on it that can say, actually, this doesn't make sense for us as the public. So maybe word it this way, and we run that back with the care provider, so it's mutually beneficial to both.
We as healthcare providers very often just lapse into terminology and jargon. We just have to remind ourselves to slow down and just make sure that everybody in the room is on the same page and understands exactly what we're talking about.
Just imagine that you're not a nurse and that you don't understand what's going on and that you're totally naive to this subject matter and what's happening, and the uncertainty is unbelievable. It's been that, us working together, getting through that we kind of get out of and think about it slightly differently.
We're looking at other opportunities to engage with patients and families to have their input into, in this case, hiring staff, and through that process identifying people that have the same kind of commitment as individuals to patient family-centered care as the organization does.
I think this is really important because a patient perspective is entirely different than the staff perspective when you're hiring people.
What really matters is your life experiences, and particularly in this case, your journey in our healthcare system.
I so appreciate when someone's willing to give so much of their time and how committed people can be to a cause and to bringing forward their wealth of experience, their story, their insight, and just really committed to helping us enhance healthcare. I just think that's such a wonderful relationship.
I think for most of us, when we're laying on our deathbed, one of the things we would like to know is that we've actually had an opportunity, whatever that looks like, to make a difference in someone's life. And so by volunteering in the healthcare system, you may not be able to identify the actual people that you've made a difference to, but you know from the outcome that it is going to make a difference.